Okay, so welcome everyone to the Wayne County Health Catalyst for COVID Care. This is a health literacy training session. We're going to go ahead and get started. We'll do intros in just a minute. But before we get started, we have a pre-session evaluation. So if you're watching this online and want to participate, please feel free to scan that QR code. Gabriella, we're going to pause for about 3 to 5 minutes so you can go ahead and either access it through the QR code or the link that Maya put in the chat. So I'm going to go ahead and pause recording. Gabriella, since it's just you, before we introduce ourselves, can you introduce yourself?
Yes, I got recently promoted here at CHAS, so I'm the new Special Programs Coordinator.
Okay.
And with that, I'm learning more and more about different grants that the clinic has. One would be the Wayne Catalyst, and along with others. So I'm just excited to learn more and get more knowledge on all this good stuff.
Perfect. Okay. Well, I'm Carolyn Custer. I'm the director of this project. Oh, just pause a second. We have someone else joining. Good morning. Who just joined us? Can you say your name? I don't want to mispronounce it. Oh, you're on mute. Good morning.
Good morning. This is Manal Nasher.
Oh, good morning, Manal. Thank you for joining. We're just getting started.
Okay, good.
And you're from Access, right?
Yes, ma'am.
Okay. So we're introducing ourselves. Gabriella's from CHAS, and we're going to have an intimate discussion about health literacy. And so I put together this material in consultation with the rest of the team, the grant team. Maya, go ahead and introduce yourself.
My name is Maya Thompson. I am with MISHWA, Michigan Community Health Workers Alliance, and I am a graduate of Wayne State in their community health program. And through that, I obtained my CHES certification, which is a certified health education specialist. Very similar to the CHW certification, but it focuses a little bit more on the planning of programs and implementing and evaluation of programs that help provide CHWs with the resources that they need to be right on the ground.
It's a great thank you. I appreciate that. Yeah, I asked Maya to explain a little bit more because this is a little bit different than the CHW. All right, any questions? Well, let's get started. Okay, so our agenda today, we're going to go through health literacy. We'll talk about 5 health literacy interventions. These are things that you can use when working with clients to increase their health literacy, specifically around COVID in the vaccination. We'll take a quick break and come back and talk specifically about some strategies to overcome vaccine hesitancy. And of course, like I just said, this is interactive. We really want your feedback. Please feel free to just, kind of join in or put something in the chat box if you'd like. All right, the learning objectives, describing health literacy as a determinant of health, understanding that inequity that we're going to talk about, and then some strategies to address that. So specifically, culturally and linguistically appropriate services, reflecting on strategies for culturally competent care, and understanding public health messaging. So why are we doing this? We're doing this to be able to mitigate vaccine hesitancy in general. All right, so we're going to start with this picture of equity. You know what, before we start that, let me make sure this is recording. It is, okay. Last time, the whole thing, I was like, oh, it didn't record. Manal or Gabriella, do you recognize this picture?
Yes, I've seen it a couple times.
Yeah, I think this is pretty well known. So we're going to talk a little bit about equity before we get started. And here, this is a very common picture of the difference kind of between equality and equity, right? So equality, everyone's treated the same. Equity, everyone is treated fair and impartial to get the desired outcome. And health equity, we take it a step further when we talk about health. Equity everyone has a fair and just opportunity to attain their highest level of health, right? So we think back to Maslow's hierarchy, and we all know at the top, right? We're healthy, we're well, social beings. So That's what we're getting to. So the next slide actually is kind of the same picture, but it adds this third picture, which is the kind of showing what justice looks like, social justice. We're out here, we're social justice warriors working towards, you know, decreasing inequities and increasing equity. So here's the idea that we remove the cause of the inequity in the first place, and therefore you don't need any accommodations. And that's kind of what we're working at right now. The Giving Tree is one of my favorite books. So I found this and I was like, oh, that's kind of cool. So inequality, unequal access, you know, equality, equal access, but is it really equal, right? Because just because you get the same doesn't mean you can reach or get the apple. Equity, using those tools like we talked about, and then justice, right? Removing the problem in the first place, fixing the tree so it's even on both sides. All right. Social determinants of health. As a community health worker, I'm sure you're all familiar with these concepts, but you know, like what they say all the time, 20% of health is the clinical care that you receive in the office. So as a doctor, I can treat you right based on what I know, but 80% of your health really comes from all these other things that we don't really address, but we should. So looking at different factors that impact things like food, right? Education, health literacy is one of these social determinants. It having a low or higher health literacy level can impact how healthy you are. Any questions on this first part? All right, I think I'm going to turn it over. Wait, no, I'm going to continue. See, this is where, sorry. All right, so health disparities, right? Preventable differences in the burden of disease. So we do see, you know, maybe diabetes rates are higher in a disadvantaged population because they have access issues with insulin or healthy food or safe neighborhoods to walk in. So these are what we're talking about. Like I just said, they exist because of these health inequities and factors. And systems designed with structural racism. So in the United States, we have to acknowledge that over time we have had and we still have an issue with structural racism. Okay, so would either of you like to come off and tell us have you ever heard of redlining before? Do you know what redlining means?
I have not.
Okay. Manal, any comments?
Me neither.
Okay. All right, so this map right here is kind of what we're talking about with redlining. So these are policies that were put into place in 1939. And we're almost 100 years and we're still, you know, this caused all this. This is part of the cause of all the issues that we see. But basically, there was a red line on 8 Mile in these areas. And if you were not white, you had to live within these areas. You couldn't live out in the suburbs. And so, unfortunately, African Americans and minorities of color were almost not forced, but you know, forced to live in areas where there wasn't a lot of access to healthcare, education, etc. So by putting this policy into place a long time ago, you know, this is where we're at. We have to acknowledge that white supremacy plays a role in what some of the things that we're going to talk about. Any questions?
No questions.
Does redlining make sense to you, Gabriella?
Yes,
Okay.
and I can see how it's like still present.
Manal? You came off mute. Do you have something?
No, I don't.
Okay. All right, I'm going to turn it over to Maggie, I hope.
Right, like Dr. C said, we're going to be a little bit more interactive. Do any of you guys have a personal definition of what you think health literacy means to you, if either of you would like to share?
To me, health literacy just means the knowledge that one has or the access to information that a client or patient might have regarding healthcare.
So personal health literacy as it's defined is the degree to which individuals have the ability to find, understand, and use information and services that inform their health-related decisions and actions for themselves and others. And then Dr. C will talk about a little bit more about Healthy People 2030.
All right, so have you heard, either of you, about Healthy People? It comes out every 10 years. If not, that's fine.
No.
Okay. So like every 10 years in the United States, we come up with a plan for health, right? And that's called the Healthy People Report. And the interesting thing about Healthy People is in 2010 and 2020, personal health literacy was listed as part of the goals for the health of the nation, to improve the health of the nation. However, in 2030, we added another component, which is the most important thing in my opinion, which is organizational health literacy. So not only looking at it, the onus is not on our patients or clients. We have to be also a health literate organization, meaning we're presenting things in a way that people can find and use and access that information. So this is why we're kind of doing what we're doing. And this is what we're talking about, creating a health literate organization. All right.
So there are several different components to health literacy, those being literacy and then numeracy. So there's skills and knowledge needed to interpret health information. So literacy being reading, writing, the basic math, speech, and comprehension skills, whereas numeracy is understanding how that math is being used in real world scenarios and being able to apply it. And then there are different factors that impact health literacy, that being, state of health, cultural, the complexity of the health information is huge to emphasize there of making sure that we are paying attention to how complex the information that we are giving clients is and that they can understand it, as well as language and age. And then the way that health information is communicated by health providers.
So we talk about that a lot.
So these are a couple of the skills. It's the same thing pretty much as the previous slide, but there's the individual factors and then there's system or professional factors. So different types of communications by public health practices, access to services and resources, and skills and knowledge and experience by public health workforce all plays into health literacy. The impacts of health literacy, there are people with limited health literacy are less likely to use preventative health services. They're less likely to effectively manage their chronic diseases, more likely to have poor medication adherence, and then they have higher rates of hospitalization and use of emergency services, higher mortality rates. And then one of the big ones is they report a sense of shame about their health literacy. These are all associated with higher healthcare costs and expenditures. Impacts of limited community health literacy. So there's missed opportunities for services, lack of preparation for emergencies, missed warnings about environmental health and safety, such as contaminated water, which is common, misunderstandings about food safety and health warnings for food safety. So for most health education materials currently are at a 10th grade level or higher. And then the average reading level of adults is eighth to ninth grade reading level. So what we want to do is make sure it is at a level for for everyone or the majority of people. So keeping that at the fifth, sixth grade level keeps it under that average level. So it will be more accessible for everybody.
And if you didn't know, you can always check the readability, like the grade level readability. So in Word or whatever document, when you go to the review tab, you can find it. But it will actually say, this is written at a, 12th grade level versus 5th.
So for a few of the red flags that we want to look for low literacy, a couple of those are frequently missed appointments, not being able to comply with medication instructions, to not be able to name medications. They're unable to give a, a coherent health history. They don't ask as many questions is one of the bigger red flags, and then they don't really follow through on different referrals.
So I don't know if you've had a person in front of you, Manal or Gabriella, that, you might be explaining something and they just kind of nod. And we're going to talk a little bit more about this. But, and then you say, do you have any questions? And they say, no. That could be a red flag. So just like we said before, reporting that shame of having a low health literacy, that sense of shame can really cause people not to be as open as they might be. So something to look out for. Okay, we're going to talk quickly about the universal precautions approach. This is from the AHRQ, Agency for Healthcare Research and Quality, toolkit. And so, are you two familiar with the bloodborne pathogens? Everyone knows bloodborne pathogens, I feel like.
Yes.
Okay. So of course we use universal precautions with bloodborne pathogens, right? We don't know if the person has HIV or hepatitis. So if we're around bodily fluids or blood, what do? We put on our gloves, our mask, whatever. Same thing for health literacy. You can't tell if a person has a low or high health literacy just by looking at them, kind of just like, the bloodborne pathogens. So really what we encourage is this universal precautions approach. And that approach just allows us to really communicate in a way that anyone can understand and forces us to use language that anyone can understand. And really the goals of this, of course, are to simplify communication, confirm comprehension, reduce risks of miscommunication, making it easier to navigate. I mean, healthcare navigation is a huge thing that you all work on, and supporting the patient's efforts to improve their health. The more we normalize, less we stigmatize. And then this slide I'm not going to go through, but this is just kind of what we're talking about. What does it mean to be a health literate organization? So you can see all these different spokes in this wheel. Being a health literate organization, which by the way, CHAS and Access are excellent organizations already, but the leadership will prioritize it. It will come down, you'll consider it in everything you're doing, project planning. And the other thing really is including your populations to help, kind of mold services. So these are some of the things that you can consider. And that is the end of our intro. So Maya.
Either of you want to share time when having low health literacy impacted you or a loved one's ability to be healthy?
Yeah, so personally, my parents both are only Spanish speaking, so they're really hesitant of even going to the doctor sometimes, unless I accompany them. In those cases, well, I feel like I'm directly impacted because I see how much they struggle, so I do the best I can to help them out.
Thank you for sharing this. A good example. Any other examples?
I work at Access, and many people who comes here don't know nothing about healthcare, so I had to explain it to them, print some stuff. I don't experience that in my household, but I do experience it in Access. So I try my best to explain to them, provide them with printable papers. That's all I can do.
Yep. Okay. Another good example. And we will talk about cultural diversity and how that can impact health engagement. Okay, we're going to move on.
So some different interventions that we can use. We're going to review evidence-based interventions and strategies that you can use to increase the personal and organizational literacy levels. And then these can be used to create, I know that it sounds like both of your organizations already are pretty health literate, but be able to create a more health literate environment. So the first strategy would be clear communication. So making sure that you're greeting clients warmly, you're making eye contact, listening carefully, making sure that you're really showing them that you're listening to them, using the client's own words. So it's making sure you're speaking in a way that they'll understand. So you slow down, you're being specific and concrete, you're repeating content, demonstrating how it's done, showing graphics, and then inviting their participation while encouraging questions.
Gabriella,
couple different
I'm
things.
sorry to interrupt. Are you at the office?
Yes, sorry. There's like background noise.
That's okay. That's fine.
So a couple different things to consider when communicating about health is making sure that you're following these 7 different aspects. So making sure that people are going to trust the information and the source of the information. Making sure that the information that you're providing isn't too much, but it's also enough and it's necessary. Making sure that it's something that they might be motivated to be able to do. So if it's relevant to what they're trying to achieve, their environment that they're in, the capacity to be able to act on the information, and then their perception and their response. So, how they're going to respond to it, and how are they going to be able to stay engaged when you give them that information.
Okay. So yes, next time you're planning any sort of campaign, you pull this slide out and answer these questions. All right, using plain language, I'm sure you've heard this several times, but again, medical jargon can be really confusing. As a physician, I know that we could tend to use bigger medical words, which isn't necessarily the best for the client. One thing that I always bring up is the word diet. When people hear, maybe not so much, and when people hear the word diet, a lot of times they think of like Jenny Craig or Weight Watchers or, Atkins but really what we're asking them is, what do you eat every day, right? So just important to phrase things in a way that your population can understand. All right, your COVID test is positive. So again, another example of plain language. We were doing a health fair and someone tested positive for COVID, and they thought that was a good thing because positive means good, right? When you think about being positive, being happy. And so we had to explain, no, actually, in this case, positive means you have COVID. So we stopped writing positive, negative, and we started writing you have COVID or you do not have COVID. And that's okay. We adjusted what we needed to communicate, how we needed to communicate with that particular situation we were in. All right, so really the first, and before we go on to our next intervention, just so you both know, this grant, we are training people on these interventions and then asking you to kind of use them when you're working with your population. So the 5 that we go over are the ones that are included specifically for this grant. Okay, so the next one is using effective health education materials. I love this part. So we're going to start with those handouts that you talked about, Manal, those papers. So let's talk about that. Remember that readability. So check your readability, aim to put your materials at the 5th to 6th grade level. Materials that are good, the purpose is clear. We talked about information overload. We don't need that. Again, avoiding medical jargon, using common everyday language. Breaking up the material into chunks, words can be really cumbersome, right, to look at. Identifies an action item, visual aids are used, so, diagrams, pictures, colors, and be aware of confusing numbers. Statistics can be confusing. So what we're going to do now is I'll have you both come off mute when you're ready, and we're going to actually look at some materials together and kind of evaluate what you guys think. So the first 3. All right, I hope you're not looking at a phone because you are going to have to zoom in, but the first 3 are all related to children. The one on the left is MDHHS. It came up with Keep the School Year Fun Going. The one on the right is from the CDC. You can see this child smiling and then this. And then the one in the middle is the Authority Health, Keep Your Cubs Safe. So and there's no wrong answer here, but if you look at these 3, which one do you think would be most effective with your population that you serve?
I think
I
For me, the first two.
Gabriella, you said the first two?
Yes.
I think that was Manal, but I would also agree with the first two.
Okay. And why don't you like the third? What doesn't work?
It just looks too busy, too many words. It
Yeah.
doesn't really catch the eye.
Yeah.
It
Manal,
just
the same.
attracts it attracts them. The pictures, the words are simple, and really easy to understand.
Yeah. I mean, keep your cubs safe, right? I think most
Yes.
parents, that's
Yes.
pretty relatable. And this one, like you said, small font. This one's not bad either. Not enough, there's not information overload. The only thing I'd say is the action item's a little less clear. This one's very clear. But they're all, so these two are better and this one's not better. And that's kind of what we've talked about over the past. Let's go on to the next set or this one. Okay, so what do you think about this flyer? This came out right when the vaccine was starting to become released. I think it was December of 2020. And so, they were trying to have people not be worried about the vaccine, but what would your population say if you showed them this? Scientists have taken 100 steps, decades of research, months of clinical development, volunteers, science, yada, 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 yada. What do you think about this? Would this work for your population? Would they look at this and say, oh yeah, this makes sense. This is what I'm gonna, and this picture, what do you think about this picture?
My population would probably not understand anything of this.
Okay, fair.
Same thing.
Same, okay,
They will understand it, but they're not convinced.
right. Is it effective, right? That's the question. Well, I didn't like it at all. Okay, so the next three I'm going to show are similar, but the point of this one is, this one came out with the Omicron booster, which is great. But anytime you have multiple asterisks or different, superscripts with small print, this is just an example of a confusing message, right? We want to be very clear with our public health messaging. We're doing the best we can. And I know that there were a lot of different vaccines available, but for this type of flyer, right? The small print in that is what is the confusing part. This one is another example. So I don't know if you had issues with this one, but I had friends calling me like, my daughter, she has COVID, she's day 6. She still has a fever. They want her to come back to work with a mask. And I was like, but anyway, again, they had these messages with these asterisks and these small prints, and it really did cause some confusion because even though it says may leave your house on days if your no symptoms are improved, may leave your house on days 6 to 10 for whatever reason was what people read. So this is just another example of how that can become confusing. Does that make sense?
Yes.
Okay.
Yes.
What do you think about this one? So this was kind of in the beginning as well. We got make a COVID-19 plan. We have these 4 kind of things, and then we have all this information. Any thoughts?
This one looks a little more organized to me,
Yeah, agree with
more
that.
categorized. Yeah.
Too much information?
I would say it's like too much information, like at first glance. But it looks like important information as well. So I guess it just depends on like the time that the client is taking to actually read it.
Yeah. What do you think if there was just kind of the big points, like, and then like for more information, click here.
That looks good.
That
It
would
looks
be.
like the titles are clear, and then it does come with a link at the bottom for more information as well.
However, the more information, what do we have to remember with our clients?
It'll be more confusing for them.
And we also need to make, and you're coming off at a totally different way, but make sure they have broadband, right? Or that they have internet
Mhm.
access
Oh, right.
and or a smartphone or a computer, right? So those are the things that we have to think about when we use, and we're going to talk about that. All right, I think I'm going to turn it over to Maya now for the next two.
These are a couple more from MDHHS. What are your opinions on these for this?
If your client took this or you handed this to one of your patients, what would they think?
It would be good if we translate it to our languages or to our clients' languages. And I don't know, a lot of people were not convinced that children should be vaccinated. Um, I don't know.
No, that's good. Those are good.
Yeah.
Do
But
you
it would make it easier if we translate it to their languages. So,
Absolutely. There are several things on here that are very wordy and things that might be a little bit confusing to clients talking about this multi-inflammatory system. A lot of people don't know what that is. It can be scary. So making it a little bit more readable, a little bit more precise in the information that we're wanting to display.
Yeah. What about this one?
You guys have any opinions on this of what your clients may think? Would this be effective use for them?
I don't think it would be effective. Like Manal has said, like my population specifically is more Spanish speaking, and then also the font is very, very small. So this would be really confusing for them.
yeah, it's just too much information out there. And, you know, the less, the better.
Mhm. Absolutely. So actually, these two are the same. They have the same exact information,
Oh, wow.
but I would say neither of them would be effective for the population that I serve.
This is one that we have as the Wayne County has put together. What do you guys think about this message? And do you think this would be a little bit more effective?
If it was in your language.
I think so. The message is clear, and then there's multiple options of how to get more information. They have the phone number, they have the website, and they have the QR code.
Yeah, I think this one is more effective than the previous two.
Clear information, making it very
Yeah, it's
specific.
clear, simple, and to the point, you know.
Yep. All right, so I'll let you finish up.
There's some additional tips for using different health materials. So one that you want to make sure is not assuming that your parent patients can read the materials. So when you're giving a handout, making sure you're circling or highlighting the most important points on that handout, making sure it's specific to them and their condition and their understanding, and then personalizing that material so you can add different names and medications to it. And then you're going to want to use the teach back to confirm their understanding of the materials you're giving them, and then emphasizing the importance of keeping the material so they can keep referring to it and you can refer to it when following up. And then, as Dr. C has said, making sure they have internet access when recommending digital materials is important. And then making sure you have feedback so they are able to give you what they think on the materials, and that can help you create something that might be more effective.
Perfect. Okay, so we're going to go, I'm going to show you some other sources for materials in a few slides. But we'll go ahead and get going on our third health literacy evidence-based strategy, which is Teach Back. Have either of you learned about Teach Back in the past?
No.
I haven't.
Okay, Manal?
No.
Okay, you're probably already doing it. This is the formal name for the method. So Why do we need to even talk about this? Because a lot of stuff that we talk about in the office is forgotten, right? Or remembered incorrectly. So teach back is a way of asking them, the patient or the client or family member, to kind of explain back, you're going to leave here, tell me what you're going to do next about your health. It's not a quiz though. You're not trying to pimp your patient or anything or make them feel bad. It's really on you to make sure that you can communicate clearly. It's been shown to improve patient understanding and adherence to treatment plan, decrease callbacks, canceled appointments, and improve outcomes. So some of the things that effective teach back are just like the stuff we've been talking about. This all comes back to clear communication, using good materials, etc., using a caring tone of voice and attitude, making sure that you either have, you make eye contact if that's appropriate, or you don't, and you display comfortable body language, plain language again, of course, and then the reader-friendly print materials. So using an open-ended question, emphasizing again, like I said, that the responsibility to explain is on you as the provider, and then document that you've used and had a response. So when you're talking with one of your clients, and you're talking about, whatever, you're teaching them about diabetes, this is a method you can use. So it's important to chunk and teach information. And what that really means is, if you have someone with diabetes and COPD and COVID, let's say, you're not going to go through the treatment plan for all of it at once. So for teach back, you pick diabetes first, and then you do that, and then you go on to COPD, etc. And so we're going to actually do an example of this, Maya and I, so that you can kind of get a feel for what teach back looks like, and then you can confirm whether or not you're using teach back. So we'll do a quick example, and the first one is a bit ridiculous, but it's example of a provider who does not use teach back. Okay, and the provider happens to be me. And Maya's the client. All right, so here's the non-teach back. Ms. Thompson, you have COVID. I'm prescribing Paxlovid, the antiviral medication authorized by the FDA to prevent severe COVID symptoms in people at higher risk. Paxlovid has 2 antiviral medications in it, 300 milligrams of nirmatrelvir and 100 milligrams of ritonavir. They exert antiviral efficacy by inhibiting a necessary protease in the viral replication procedure. You'll need to take each dose twice daily for 5 days. You also need to use barrier protection when having intercourse for the remainder of your oral contraceptive pack. Serious side effects include allergic reaction. You may have angioedema of your mouth and tongue, skin rash, hives, blistering or peeling skin, or trouble swallowing or breathing. Sorry, this is awful. Also liver damage, so look out for hepatomegaly, jaundice, and pruritus. Okay, so I'll see you back in 2 weeks for a recheck. Do you have any questions? It makes you laugh, right? It's a little bit ridiculous as an example, but now we're going to do an example with teach back. All right, so imagine I'm a provider. The last example, I didn't even use a handout. I was just spewing words, right, kind of at the client. Pretend now that this is the actual handout for Paxlovid, but that we're looking at this together, and we're going to do our second version. So this is a good teach back example. Mrs. Thompson, as you know, your COPD and diabetes put you at higher risk for developing severe COVID-19. I'm going to prescribe you the antiviral medication called Paxlovid. This is what a dose of Paxlovid looks like. There are 2 pink pills and 1 white pill in the packet. You have to take the whole packet 2 times a day for 5 days total. Here is some additional information about taking Paxlovid. I've highlighted the most important instructions, such as taking the pills whole. And here's a list of medications to avoid that you cannot take while you're taking Paxlovid. Are you taking any of these medications?
No.
Okay, great. One other thing with medications, Paxlovid could cause your birth control pill not to work right. So if you have sex this month, it's important that you use a condom or another barrier protection. Here are some side effects to look out for. The most important thing to look out for is liver damage. If you have any, if your skin or your eyes turn yellow, or you start to get really itchy, or pain in your abdomen right here, we want you to call the office right away. And here's some other side effects that may happen. If they do, they're mild and usually last about 3 to 5 days. Okay, so I'd like to make sure I explained everything clearly to you. Can you please tell me how you're going to take Paxlovid and what you're going to look out for?
Okay, so each pill packet has 3 pills. I need to take 1 packet 2 times a day for 5 days and avoid these other medications. I can't remember what side effects to look out for.
Liver damage is the big thing to look out for.
That's right. I'll call if I notice my skin or eyes turning yellow and my skin gets really itchy. And if my urine gets dark, will do, doctor.
Okay, so it's a very quick, easy example. Can you kind of see the difference between teaching and talking? And you guys, do you basically use this technique is my question.
Yes, and I think what I noticed the most that would be really helpful was the pauses compared to like the first example. I feel like the pauses are helpful not only to see the patient's reaction to the information, but for them to process it as well.
Thank you. Good point. All right, any other thoughts, Manal?
I like that you highlighted the most important things, because when the patient get home or anything, he can read it back and just focus on these stuff,
Right.
make it easier for them.
Yep,
Instead
great.
of reading the whole thing over and over, just, the highlighted lines.
Yeah, that's a great thought. Thank you. And this is, like I said, this is the actual patient handout thing that you get from the company. So sometimes you have to work with what you get. So highlighting and circling and whatnot can be really important. All right, we're going to move on. Okay, I'm just checking. So health literacy strategy number 4 is not one of the evidence-based health literacy strategies that we're going to present, but it's something that is, it's not one of the 5 that we asked you to use with your clients, but it's just something I wanted to kind of briefly review because we did do this awesome project at Authority Health and I was really excited about it. We were actually doing health literacy activities in a laundromat for a while, and the pandemic unfortunately kind of ended that project, but we kind of rekindled with Narden Park. So we were partnered with Libraries Without Borders to come up with this campaign, Small Steps to Health. And, the point of the campaign is a lot of times, especially as physicians who may not have a lot of time, we're making recommendations for behavior, right? Like one thing that gets me every single time is you have to exercise 150 minutes a week. What does that even mean? If you're a client and you don't exercise and your doctor says exercise 150 minutes a week, it's kind of like overwhelming, right? So the whole point of this is to look at small behavior changes that can lead up to a big improvement. Humans need guidance with small steps so that we can succeed. Another thing's like, increasing water. You need to increase water in your diet. Well, maybe instead of just saying that, we say, okay, could you have a glass of water when you first wake up every day, right? That's a habit that you can get into that maybe can just be a start. Or instead of 150 minutes of exercise a week, maybe you can talk to them and say, okay, do you do, a lot of older women do YouTube videos. They like to dance with their grandkids in the kitchen. Doing chair aerobics is another thing, so just really working with the person you're with to identify a small step. And this goes, and we'll talk about motivational interviewing after the break, but this goes along with that. So again, it might not have felt like much at the time, but over time you have a massive improvement. Does that kind of make sense?
Yes.
Okay, great. So we'll continue on and we're going to talk about class now.
Yeah, so One thing that you're going to want to consider for another strategy is considering the language and culture of the clients you're serving. So Wayne County has a mix of populations with different languages and cultural beliefs. So we'll do a review of class. So the culturally and linguistically appropriate services is a framework to deliver healthcare services. It's ensuring respectful and responsive communication to patients' cultural health beliefs and their preferences, and then their different communication needs as well. And that is so we can promote health equity and reduce disparities. So there are a couple different themes with that. Principal standard, governance, leadership and workforce, communication and language, and then engagement and continuous improvement with accountability. A couple different strategies to implement. There's one that is language related. So for language related, you're wanting to make sure you can access their language preferences, or they have access to different language preferences and language assistant needs. That services are using acceptable language, are able to, sorry, that you can use acceptable language assistant services and to not use the unacceptable. And then to be able to plan for interpreter services in advance, and then providing written materials in patients' preferred languages. And then on the flip side, there is culture-related strategies. So making sure you're respectful when asking about patients' health beliefs and customs, and then avoid stereotyping based on the cultural or religious background, and then acknowledging and addressing that implicit bias.
Okay.
So there's a couple do's and don'ts, and I want to make sure that we acknowledge the fact that the don't use is oftentimes something that's not available, and that we're not necessarily isn't something that we can't do. So for do use, we want to use bilingual clinicians or staff members whose proficiency has been confirmed, so they're able to properly translate what you're wanting to address. To use staff who are trained as interpreters, to use on-site medical interpreters, and then telephone or video medical interpreter services. What we want to try to avoid, but is not always possible, is staffs who are not trained or certified as medical interpreter, and then the patient's family and friends. And I know that has been mentioned before that a lot of times it is the child or a family member who accompanies parents to health visits. So, but it does pose a problem with patient privacy. And if the client insists, you respect their choice and have a qualified interpreter present. And then minors hopefully should never be used, but also, again, like we mentioned, it's not always possible.
So I'm going to take a pause right here, Manal and Gabriella. I want to know about your experience working with non-English speaking as a first primary language populations. Go ahead, Gabriella.
Well, personally, because I've always been in Southwest Detroit, my norm would be being around Spanish speaking people. So once I started uh, working at CHAS, it was just basically doing a little bit of the same for me. I get to work with my community, and what I've noticed from them is that they're really grateful to have someone that speaks their language and can simplify terms and can explain things to them. We get a lot of God bless yous, we get a lot of hugs from our clients. So it's really fulfilling. I feel like my job is really fulfilling.
Thank you for sharing. Any thoughts about that, Manal?
It's pretty much like Gabriella's, but we're not working with patients, but we're working with clients. But we get a lot of compliments because since we're translating for them and all that. But I noticed at many times, even though they know we speak their language, but they still bring their minors to the meeting just to translate for them. Sometimes they take them out from their schools and all that. But once they get comfortable with us, they don't bring them anymore. So
Okay. Okay.
yeah.
Yeah, so there's a balance, right?
Yes.
Okay. We'll turn it back to you, Maya, if I can get this slide to move. Okay.
So, U of M has created a great guide for different materials in other languages. So, here's kind of just some examples of what they have in different languages. So, they have a ton of different resources on tests and procedures, diseases and conditions, different planning for healthcare, and then healthy lifestyle and safeties in all of the languages listed here. I think this is just a great guide to be able to make sure that there are resources that you can give clients for any language that they speak.
And I will say they took a lot of work putting this site together. And everything on this site is 5th to 6th grade reading level. So whether they found it somewhere and they procured it or they created it themselves, it's all at the right readability level. So take a look.
I love this.
Yeah.
It's great.
So we have just a couple additional resources and handouts of different languages from MDHHS. So they have the same, and same with the Wayne one from Wayne County. It's the same information on the page, but just provided in native languages.
Yep. So this is our campaign that's running currently, I think. Okay, so let's move on to cultural competency. Again, like we talked about, Detroit, we have a lot of different cultural, religious, spiritual, ethnic, considerations when we talk about healthcare. So we know how these things can influence how patients understand health, how they take care of health and make decisions. So when we talk about cultural competency, we're talking about, the principles that we've talked about this whole time: trust, respect for diversity, equity, fairness, and social justice. And really, cultural competency is a set of attitudes, behaviors, and policies that allow people to work effectively in cross-cultural situations. So let's take a little bit deeper dive. Some of these you may be familiar with, but of course, different cultures have different ways to engage with health, like I said. Sometimes health beliefs, there are some cultures that believe talking about an outcome can cause it to occur. So, when we talk about prevention and things like mammograms for breast cancer and whatnot, that might be something people don't want anything to do with because they don't want to talk about breast cancer, right? Customs, family members may play a large role in the healthcare decision-making. Ethnic customs, roles of women and men in society may determine who makes decisions and what kind of medical treatments are accepted. Religious beliefs, we do know that some religious and spiritual beliefs may affect how someone accepts like specific treatments, for example. Dietary customs, this is something that has always driven me crazy since I've been doing public health. If we're recommending dietary changes like the DASH diet, we need to assess first, what does this patient's diet look like? Are we recommending foods that they have no idea what we're talking about? It would be so much better if we could just come up with some diets with different cultural foods so that we can, come up with a way for you to eat healthier, but using foods that you're familiar with. Anyway. Interpersonal customs, again, like we've said, eye contact, physical touch may or may not be acceptable depending on your population that you're working with. Implicit bias. So everything we're talking about right now, these are things that you can start to even take like a whole course on, right? So I encourage you to follow up and look for more information on any of this stuff that you're not familiar with. But implicit bias is important for cultural competency. We all grow up in different situations. We're raised a certain way, we're in a certain school system, whatever, right? But we develop our worldview, we develop our opinions on how things are. And sometimes, because of that, we have unconscious and sometimes conscious bias that results. So addressing implicit bias is really just, taking a look within and understanding your own beliefs, values, and customs to become more respectful and understanding of others. Remember, your life experience is a point of reference. It's important to learn from other cultures. It's not necessarily better. The American way is not necessarily better. And it's our job to reflect and make sure, right, that these biases don't impact our level of empathy or the way that we communicate. So these are all very important things to consider. Oh, Harvard has an implicit bias test. That's kind of interesting. So I put the link in the slide. Patient-centered awareness strategies. So we talk a lot about patient-centered care. Just means that we're considering the patient, right? What do you prefer? What do you need? So some of the patient-centered strategies are, we kind of just talked about this, but to remember that race, ethnicity, gender, spirituality, and other issues can play a role in the perception of care. It is so important, and I believe, Manal and Gabriella, that you do this, but to really understand the community you serve and the different cultures that make up the community. Talking with people, understanding their beliefs and backgrounds, developing cultural humility, right? Do not think your way is best. Practicing cultural etiquette, that just means be respectful. And study when you have time. And the HHS Office of Minority Health has some great resources to learn about culturally competent care, so I encourage you to follow with that. All right, so empathy and open-mindedness are essential. All right, has anyone read or heard of this book, The Body Keeps the Score?
Not me.
I've heard of it. I have not read it yet.
Okay, it's not tough. It's a rough read. It's a lot of trauma.
Oh,
It's a great book. Dr. Bessel van der Kolk is a psychiatrist who has always understood trauma and how it impacts health. So it's a good book. Have you ever heard of toxic stress, either of you? Or how about adverse childhood experiences?
Yeah.
Okay. So I bring this part into this lecture to go with the culturally competent care. Being aware and informed about trauma and how it impacts health is part of that. We understand that toxic stress trauma impacts the body both physically and mentally. So I'm going to take a quick, we have like a minute. When you think about stress, right, Manal and Gabriella, like think about how it is if we saw a bear in the woods, right, we get that fight or flight reaction. It helps us run away. When you get that fight or flight reaction, that increases some levels of hormones in your body. And normally that stress, you get a stress response, it comes right back down because, you've dealt with the threat, you understand, or whatever it is. That's tolerable, or I'm sorry, that's positive stress, right? So tolerable stress is a stress where you get that fight or flight and it doesn't come right back down to normal state, but you have some sort of buffering or protective factor. So for example, a positive stress would be like taking a test at school, right? You get a little nervous, you get a little stressed, but you do well. That helps your performance. It goes away right away. Let's say some kids are in a car with their parents and driving down the freeway and they see like a terrible car accident where there's potentially like dead bodies on the ground. That's a stressful situation for a child. But the parents in the car are there to kind of protect or buffer against that stress and help that child to regulate back to normal. Toxic stress situations, they don't come back down to baseline. So you're getting that fight or flight feeling and it's constantly happening. So you're constantly having that pain in your stomach and you're kind of just never come back down to baseline. And that can happen, if you have a toxic situation, something like if a child, if their parents are constantly fighting, a domestic violence type situation, there might be fighting all the time and the child doesn't feel safe ever, right? So that's kind of that elevated cortisol level, that hormone cortisol really can impact health. So I encourage you to follow up and learn more about this. And that was my soapbox for the 5 minutes. Do either of you have any questions about what I just said?
no questions.
Everything is clear. Thank you.
Thank you. All right, Maslow's hierarchy. We brought this up, or we bring this up just to kind of show you, during the pandemic, I mean, even now, right, there's a lot of mental health things happening in our country, behavioral health issues. And we want everyone to get help for that, right? But if you have a client sitting in front of you and you're like, we need to set up therapy or we need to set up counseling, but that person, let's say it's a mom with nothing to feed her kids that night, or maybe they don't have a place to stay because of domestic violence. The whole point is, if these basic needs aren't met first, anything you're trying to do up here on the pyramid, like, yes, we want you to have a sense of connection. Yes, we want you to have self-esteem and respect, but these are the most important things first, and safety, and security as well. So just always remembering the basic needs first. I'm actually going to kind of skip through the pair of ACEs. Like I mentioned before, the toxic stress and the adverse child experiences. This slide is just to show you that there are adverse child experiences, but they're occurring potentially in an adverse community environment. So the social justice work, the structural system work that we're working on is to address these things, right? The community level things, the country level things. We're going to go through that. All right, this is our last slide before the break. When I do a lecture on trauma-informed service with some graduate students, these are the questions that I usually ask them. So we're going to go through these questions, and then you're going to get a little break. Have you considered the trauma this person has experienced? You can put right in here, have you considered the culture, right? Or the language? Are you creating a safe place for this person to share? Certainly you need to think about the environment you're in and working with. Is it somewhere that the person you're with feels safe? Will they share? Do you have any bias that you need to consider? How does your background, history, etc., impact your ability to serve this person? Are your actions making people uncomfortable? Are the words you're using respectful and culturally appropriate? And are you actively listening, or are you just talking or listening to talk? So these are just some of the things to think about when you're talking about being culturally competent. Okay, I talked way too much. We're going to get out a little bit early today. Any questions or thoughts before we take a quick break? All right. So I'm going to turn it over to Maya.
Perfect. We're going to review the second half of this, which is going to be talking about vaccine hesitancy and different strategies to overcome the COVID-19 vaccine hesitancy. So, vaccine hesitancy, as defined, is a delay in acceptance or refusal of vaccines, despite some availability or the availability of services. It is one of the top threats to global health currently, and there's a few effective strategies address this continuously growing problem. Some of the causes would be healthcare and socioeconomic inequalities and inequities. There's a lack of effective public health messaging, unethical research. I think it's been shown over the years of the research involving ethnic minority groups, and then structural racism, as mentioned previously. Social disadvantages, so the social determinants of health, so lower levels of education and access to quality information. And then the growing spread of misinformation, disinformation, and conspiracy theories through online platforms, social media. We all hear you don't believe everything you hear on the internet, but unfortunately, that's not the truth for everybody. Barriers to access, including vaccine delivery time, different locations, and the cost related to socioeconomic inequalities.
Yes. So how do we build trust, right?
So there are different CDC recommended strategies, and those are included as motivational interviewing and combating misinformation.
All right. Thanks, Maya. I think I messed this slide up, right? So I'm taking over now. Okay. All right. So have you learned about MI, Manal, or Gabriella, or have you used this technique at all?
I have not.
Okay. Okay, we're going to go ahead and get started. So basically, this is a technique that you have to practice before you get good at it. Let's just put it that way. So again, follow up, learn more about this after this session. It's a guiding style of communication. It's just a way of like, just really being curious with your patients, right? And just what motivates you? So let's talk about it. It's designed to increase the patient motivation. It's based on a respectful and curious way of being with people that facilitates the natural process of change and respects autonomy. So again, patient-centered. We want to know what they want for their health. This chart just kind of shows the difference between the more traditional type approach. So we say traditional with quotes, but we know, for many, many years, the thought was the doctor knows best. They are the expert. The patient doesn't know anything. They need to be taught these things, and they need to follow the orders of the doctor. The doctor might know how to treat a disease really well, but the doctor doesn't know who you are as far as all the different things happening in your life and how they impact your ability to be healthy. So we don't want to do that. We don't want to assume that approach. What we want to do instead is really talking about motivational interviewing. So really, it's a collaboration. It's a partnership between you and the patient. You make decisions together, just like patient-centered care. Evocation. So I'm going to ask you some questions to get your brain going. And I'm going to listen to you actively, and then we're going to talk about it. So at the end of the day, it's up to the patient. It's their choice for care. So ORS is a type, one of the methods, right, of doing MI, and it's 4 parts. So we'll go through those. Open-ended. So when you start a motivational interviewing session, the first thing you're going to do is ask an open-ended question. So how do you feel about COVID-19? Tell me more about the vaccine and what you're thinking about it, right? So rather than asking questions that they can answer with yes and no, will you get the vaccine? No. Okay, that's it. No, we don't do that, right? We want to just tell me more about this. Affirmations are important because they show that you're really actively listening, reflections as well, but affirmations is just, encouraging the client. So it takes a lot to go through what you must have a lot of strength. It takes a lot to go with what you're going through, those types of things. And then reflections is another part. So you're listening actively, you're asking this open-ended question, you're listening for information. You're kind of encouraging them, but then you're also going to reflect. So using their kind of language too. So if they're saying something, you might want to say, let me make sure I understand you clearly. You've heard people say this, or what I understand, or it sounds like, or it seems like you're saying this. So what I hear you saying. So these are things just to confirm, because you need to make sure you're hearing them right, because they might be trying to say something else, right? Oops. And then the last part of it is summarize. Summarize is kind of where okay, this is what we've talked about, right? You've stated, that you want to be able to spend time with your grandkids. But that you can't do that unless you get the vaccine, right? So you're kind of like pulling out what they say and using it as their motivation to do the behavior you're talking about. So this is complex. This is a technique, but does that kind of make sense?
Yes.
Okay. Specifically about COVID-19, again, there's some strategies. Don't assume vaccine acceptance. We're way down the line. This was, if this was 2021, it would be a different conversation, right, than what we're having right now. But again, open-ended questions, don't assume that the vaccine's one way or the other. Acknowledging concerns without judgment, being empathetic, having empathy. Avoid criticizing the information sources. It could be a leader of the church. It could be their parent. I mean, you don't know who told them the information, so you don't want to just start criticizing. Instead, you just provide high quality information. Messenger status. So all of you in this grant, every community health worker in Mishwa and out, you are all messengers, right? You're part of the care team that kind of holds it. You're the glue that holds it together. And so it's important as a community health worker to acknowledge that you are that patient advocate, that person that can assist the patient in being healthy. And like I kind of just gave the example of the grandparent who wanted to see her grandkids, linking it to their hopes or desires, things that you've heard them say, that will show them, showing them that the vaccine is a way to kind of get where they want to be. And it might not be the COVID-19 pandemic. This might be for the next pandemic, which will happen. But these are, again, things that we'll have to keep in our work box, our toolbox. So we're going to do an example. Oops. And then after that example, we're going to kind of wrap up with combating misinformation. But again, we're going to do 2 different scenarios. The first one is going to be not using motivational interviewing. So the first one's based on a traditional approach. Doctor knows best, doctor gives orders, patient accepts, right? Not really, but that's the view. So let's go ahead and get started. It's important to immunize your child. If not, you're putting him in danger. Do you know there are still cases of measles in the United States? This disease could be very dangerous. And what about meningitis? It can be fatal, You should update your child's vaccines as he's already late according to the schedule. We can do that now if you want.
I don't see the urgency, and autism is worse than measles. There are far more problems than solutions with this vaccine. It is completely unbelievable to give so many vaccines at the same time.
Studies have demonstrated that there is no link between autism and the measles vaccine. The vaccine is safe, I assure you. You should be aware of the information you're finding on the internet. Giving several vaccines at once is fine. It's not associated with more pain. We should update them now.
I've heard something else, and not only on the internet. I've read a lot, and vaccination is not mandatory. I can do what I want.
Yes, you're right. It's not mandatory, but you're putting him and other children who cannot be vaccinated in danger. The risk of disease are much higher than the risks of the vaccine. If I'm taking this time to speak with you, obviously it's very important.
It's easy for you, quick, but what if he gets autism? I'm worried about the risk of vaccines, but you don't seem to be worried about the health of my child.
Of course I am, and I'm worried that he could get diseases that can be prevented by vaccines.
I think we don't understand each other. Let's talk about this another time.
Okay, so that example, I'm trying to convince mom to vaccinate her child. I'm not listening to mom. And what happens? She gets turned off and doesn't vaccinate, right? Okay, so let's do round 2 with the motivational interviewing approach. Hello, Mrs. Thompson. What do you think about the advantages of vaccination?
Well, I know that vaccines protect children against several diseases that we don't see anymore. My child received all of his first vaccinations, but I am worried about the measles vaccine that could cause autism. For other vaccines, I have fewer doubts, but I'm still hesitating.
As you've said, vaccines have reduced diseases in such an important way that they're now much less frequent. It's why you vaccinated your child as a baby. If I understood you correctly, with the exception of measles vaccine, other vaccines seem safe to you?
Yes, I know it's a good thing to prevent those infections, but about measles, I'm conflicted. I've read a lot of books and articles. Lots of people are worried about the link between measles vaccine and autism.
So you find it's important to protect your child against diseases when the vaccines are safe, but you're worried about what you've heard regarding autism and measles. I see that you've done a lot of research about the subject. If you agree, I could give you some additional information for studies on autism and measles.
Sure, I want to know exactly what happened.
In fact, you're right. One study had hypothesized a link, we would never use that. One study had hypothesized a link between measles vaccine and autism, but this study was fake and the author lost his medical license. More than 500 additional studies around the world have demonstrated there is no link between vaccine and autism. The frequency of autism is the same in a group of vaccinated children as in a group of non-vaccinated children. Excuse me, what do you think?
Well, so I'm not crazy to be worried about that.
Of course not, you're totally right.
Thank you for taking the time to understand my concerns. I think it's a little bit clearer now.
Okay. So I started with an open-ended question. Do you see the difference between the two?
Of course. Yes.
Yes.
Yeah, so allowing her to kind of state what her issues were, right? Okay, so continue to research motivational interviewing and work on the technique. I practiced on my family and it worked, and I was so bananas. I was like, what? Actually, my niece was my practice. Okay. All right, so motivational interviewing, we're gonna go finish up with combating mis and disinformation. Does anyone know the difference between the two? So what is misinformation versus disinformation? This might be a little, go ahead,
I
Gabriella.
know misinformation is like wrong information, correct?
They're both, yep, they're both wrong.
And okay, so I'm not quite familiar with disinformation.
Okay, fair enough. So really misinformation is shared, false information shared, but the person who's sharing it doesn't really realize they're sharing false information. It just has been perpetuated. Disinformation is purposefully false material that is purposefully spread to try to institute, to try to cause confusion in populations. So does that make sense?
Yes.
Yeah, so let's talk about social media. So very quickly, I wanted to show this slide just to remind everyone, there are so many different places where people can get information. You know, it's no wonder that there's misinformation and disinformation. So some strategies, again, like I said before, providing that factual, easy to understand information. Don't judge, use credible sources. We get into a situation sometimes where people don't believe credible sources are credible, for example, the FDA or the CDC, but that's a whole nother lecture. So those are our trusted sources. And using the trusted messengers, like I said, you guys are the glue. We saw a bunch of commercials over the pandemic where either celebrities or, you know, faith-based leaders, neighborhood champions, doctors, hospital workers, etc. So to help you wake up at the end here, we're going to do a quiz. So let's review some factual information about the COVID-19 vaccine. And this will give us a little bit of a review, so you'll be right on top of it. Okay, so we have a new booster out, right? It just came out in September, October. Do you know what the recommended dose is for the new booster? Your choices are here. Is it 2 doses of BA4, BA5 Omicron, 1 dose of Omicron, 2 doses with XBB coverage, or 1 dose with XBB coverage, or 1 dose of Janssen? So do you have any idea what currently is recommended?
No.
I know, right? There's no way in which. Anyway, so 1 dose of the Pfizer or Moderna with XBB.1.5. So let's talk about the vaccines real quick. So the original vaccine, the primary series, was monovalent, meaning it covered 1 strain, and it covered that original strain, the Delta strain. And we all got 1, well, not we all, but people who received it got 1 to 3 doses depending on their age and the type. Then we had the original booster series, and that was when the Omicron variant was going crazy. And so this covered Omicron variants BA4 and BA5, and those, so that was the one that came out not this year, but last year. Now, these are the ones that we have currently. This is Pfizer, this is Moderna, Spikevax, and I don't know what this is, Comirnaty. If either of you know how to say this, please let me know. But these 2 are out. Manel?
No.
Okay. These 2 are formulated XBB.1.5. There is protection for these other variant strains. COVID can get very confusing with all these mutations. But basically 1 dose is recommended for everyone. There are some subgroups that have different schedules, but they're recommending that we all get this. It's interesting because there was a wave of JN1, I think is what it was. And that's actually a subvariant of BA.286. So people that got vaccinated were okay against that as well, including my mom, which I was happy about because my daughter had COVID and my mom did not get it. All right, in March of 2023, people 18 and older with the updated booster had what compared to unvaccinated? So we're talking about updated vaccine status versus not vaccinated. So were people that were vaccinated and boosted, what kind of risk reduction do you think they had, or do you know? Okay, so it's 5.3 actually was what they found. And here's a graph. Now they're not showing this data anymore for COVID, but over the period of the last year and a half, you can see the black line is vaccinated, the black line is unvaccinated, here's vaccinated, and here's with the Omicron booster. And you could see basically with the booster, your risk of death was very, very, very reduced. And then here's even the, just getting the COVID. Again, this stuff isn't being collected anymore the way it was, but we could see through a time that if you were unvaccinated, you had a higher rate of contracting it. So that's the information about that. The vaccine has been effective. Okay, the last quiz question. The new vaccine provides coverage against what? Except, oops, well, yeah. So this one was just to kind of highlight again, Delta was the original strain that was covered. BA4, BA5 were the booster, original booster. And these other 4 strains are what are currently kind of covered in the vaccine. Can I open this up and ask, have you been vaccinated this year in general? I'm going to start it off with saying I did not get vaccinated. I got 4 vaccines before, but I did not this year.
I haven't. It's in my to-do list, but not yet.
Okay.
I haven't been vaccinated for this year, but I've been vaccinated before.
Maya, how about you? I'm just curious.
I have. I got both the flu and the COVID booster about a month ago now. So
Yeah, good. I meant to get both. I sound like Gabrielle. It's on my list of things to do. It's just my son was more important last month.
exactly.
And I got COVID for the first time. I got it over Christmas break. I was in bed. And I was like, what in the world? So yes, I will say, as a younger, healthier person, we are less risk for developing severe disease. But I still encourage everyone to get vaccinated. So. All right. So another sharing opportunity, do either of you have a situation you could share where someone refused to get vaccinated because of mis or disinformation?
Yes, my kids.
Oh, how old are your kids?
I have a 16-year-old and a 12-year-old and a 11-year-old, but they all refuse to get the vaccine. They just didn't believe in it. We got vaccinated, me and my husband, but they're like, oh, we're too young, we're not gonna get sick. And I did have COVID before, but it was mild, really mild. And I think they catched it from me, but it was like 3 days they got fever. That was it. So they totally refused to get vaccinated. So this day I'm trying to convince them, but they're not. But they get the flu shot and other shots, but for COVID, they don't want it.
Interesting.
Yeah.
Has anyone said anything about a microchip? They don't want to get vaccinated because there's a microchip in the vaccine?
Yeah, they did mention that, but they're just not convinced. They said, we don't need it. We're too young and we can't fight anything that comes into our body. You know what I'm saying? It's normal, it's natural, it's, and not just my kids. A lot of people believes that.
Yeah. Yep. Gabriella, any examples for you?
Yes, when the pandemic had first started, I encountered someone who refused to get the vaccine. They claimed that if they received it, their third eye would not open.
Okay.
Things like that. Yeah.
And you can't laugh at them, right? You have
Yeah.
to be very professional about it. But that's an interesting believe.
Yes.
Anything, Maya?
Yeah, actually, my sister she practices natural health. So she's in the natural health realm. So she was very much anti like Western medicine for a few years, and she still has not decided to get the COVID vaccine. She's opened up a little bit more to the balance between natural health and natural medicine and Western medicine, but that was something that like we've had to have a lot of discussions about of um, choosing the right time to make sure she's practicing Western medicine and modern medicine, and then making sure she has that balance in natural medicine there. So the vaccination is still a work in progress, but yeah, it's definitely something that um, you have to be open to where they're at and just to do what you can.
Mhm. Absolutely. All right, let's move on. Back to Maya.
All right, so a few summaries and key takeaways. So the health literacy is very much associated with lower health knowledge, poor medication adherence, and increased use of emergency services for primary care. So it increases mortality rates and it impacts all areas and quality of life. And these are all of these are impacts of low health literacy. It's important to use universal precautions and all patients have a low health literacy level. The more that we do this, the better our services are across the board and making sure it's more inclusive. Improving individual and community health literacy levels can reduce vaccine hesitancy and increase COVID-19 vaccination rates. So our final review, making sure that all written materials are at that 5th to 6th grade level to be inclusive, and different health literacy strategies can be used to increase understanding about health conditions and empowering patients to take more active role in their health. So making sure we're using clear communication, that teach back method that we went over, making sure we're using culturally and linguistically appropriate materials, that motivational interviewing, as Dr. C has mentioned, to make sure we're going back and trying to learn more about that, and then combating mis and disinformation.
Thank you. All right, just to let you know, I will be emailing you these slides and a handout that there's a couple handouts, but I'll send the one that goes along with the training, which is kind of like a cheat sheet with the 5 interventions and then the technique, some information about each technique. Before we ask you to participate in this, I just wanted to show there's an additional training in health literacy if you're interested through the CDC. And then I did include all the resources to the things that we've talked about through the lecture. So we can open it up for questions. If you don't have questions, we appreciate you participating, and we would greatly appreciate if you could, take part in our post-session evaluation, either by scanning the QR code or the chat link the link in the chat that Maya just put. Last thing I got to say, if you are going to do the post-session evaluation, Wayne Community College District is offering a completion certificate. You can get your 2 hours of CHW through Mishwa, but you can also get a certificate from Wayne County. And if you'd like to, you'll see after the quiz part, there's some information. It'll ask to rate the session, and then it asks for some personal information. They require that. They register you as a student in the continuing education program. I'm the instructor, of course, and so that can be created. So if you're interested, you do need to put that information, and I will email the certificate in about 3 to 4 weeks. Any questions?
We
No
just thank you
questions.
guys.
Thank you so much.
Okay. Gabriella?
I was just saying no questions and thank you.
Okay, well, that makes it easy. All right, so I'm going to assume by now you've had enough time to look. I'm going to end this.